We have over 629 patients, and we followed them up longitudinally over 6 months to look at how they were coping with their cancer, well, advanced cancer, but in particular we were looking at depression because we're aware that's a very important symptom for many people. We recruited patients from 25 hospice day units. We screened them using something called the Edinburgh Depression Scale, which has been validated in palliative care, a tool called the PHQ-9, and we also looked at whether they were having antidepressant medication, how they felt physically. We asked them to complete some measurement tools looking at physical symptoms. We also used a tool to look how they felt in terms of their spiritual belief as well, and then we followed them up at 2, 4 and 6 months during the time to have a look and see how things changed in that time. The tools are very simple to fill in, that people were able to tick how they felt. So there'd be a question, for example, over the last 7 days, I have felt sad. And then you would tick if you'd felt sad every day, most days, etc. So there were tools that were specifically chosen because they are valid, so we know that they work, but also that they're easy for people who are not so well to complete. We found that actually depression was an important symptom for a third of patients. So a third of 629 patients, quite a lot of patients. And actually we found that it was a symptom that was very troublesome for many, many patients. It did not significantly get better over the 6 months of the study, which was something that we thought it might have done because these patients were within a palliative care setting, they were in a hospice setting. We found also that antidepressants didn't seem to work very well in this patient group, which was surprising to us. Therefore, we're trying to find out why that may be the case. And we also found out that patients who were depressed did not survive as long as patients who were not depressed. And that was controlling. So we took into account all of the factors in terms of how ill they were, etc. So depression was actually an independent risk for people dying sooner. I think there's lots of reasons. Possibly it is because depression makes you feel very, very, you lose interest in everything, you lose a lot of enthusiasm, and we all know that actually people with cancer often say that they have a tremendous determination to actually overcome it. I think if you're depressed, you lose the ability to have those positive thoughts, really. And I think it is very, very difficult for people who are depressed if they've got any advanced disease, so which is why we need to treat it and pick it up sooner. We are advocating screening. We're advocating that all patients with advanced cancer, whether at home, in a hospice or in a hospital, should be screened. But that not only should they be screened, but people need to take note of what they fill in. It's all very easy to give somebody a questionnaire and ask them to fill it in, but we really need to look at what they're saying and actually take that a bit further and look at best ways of managing these people, be it with drugs or looking at other interventions as well. Drugs can work, but as I say, they didn't really have much effect in our study, which we want to uncover. But a lot of patients with cancer, there's a lot of evidence that people find benefit from things called well-being interventions, which are perhaps simple interventions like painting or alternative therapies, that actually they can make a difference. That we have no clinical trials for that, but anecdotally and from literature we know that that does make a difference. And perhaps what we need to look at is a model of care that includes physical treatment, so tablets, but also looking at these other interventions as well, and not only looking at the patient but also their family too.